Welcome back, everyone, to part 5 of our Dental Coding Masterclass series. If you're joining us as a medical coder, a dental biller, or a revenue cycle pro, you are in exactly the right place. Last time, in part 4, we built a solid geographical map of the mouth by breaking down the dental quadrants. Today, we're taking that foundation to the next level. We're going to break down primary versus permanent dentition, their exact eruption timelines, and most importantly, we're going to see how these biological facts directly dictate your CDT code selection.
Here's a super quick look at our agenda. We're moving chronologically today. We'll set the biological baselines, map out the timelines for both primary and permanent teeth, jump straight into the practical coding implications, and then wrap things up.
All right, let's jump right into Section 1, Introduction to Dentition Types. To code accurately, we really have to establish the biological baselines first. You know, as coding professionals, it's so easy to get lost in the weeds with numbers and modifiers, but we can't forget what dentistry actually is. It's a branch of medicine. It focuses on the comprehensive evaluation, diagnosis, prevention, and treatment of diseases affecting the entire oral cavity. It fundamentally bridges oral and systemic health, and that's exactly why precision in our coding is absolutely crucial. When you understand the biology, coding stops being a guessing game and becomes an exact science. Let's start our anatomical journey with Section 2, Primary Dentition and Timelines. You'll often see these documented in clinical charts as deciduous teeth, milk teeth, or just plain old baby teeth. The very first thing you need to burn into your memory as a coder is the number 20. That is the exact total tooth count for a complete set of primary dentition. That's exactly 20 visits from the tooth fairy, for those keeping track at home. Let's break down those 20 teeth. A child's mouth will feature 8 incisors, 4 canines, and 8 molars. Now, what's really interesting here is the complete absence of premolars, which you might also know as bicuspids. There are 0 premolars in primary dentition. This is an anatomical fact that frequently trips up novice coders. If you're reviewing a pediatric chart and see documentation for a primary premolar, you immediately know there's a documentation error that needs clarification. And this really highlights the rapid developmental window of primary teeth. The biological clock starts ticking around 6 months of age when the very first teeth begin to erupt through the gums. By the time a child reaches about 3 years old, that full set of 20 teeth is usually completely present in the mouth. By mapping out specific eruption and shedding timelines, we can better understand the age-appropriate clinical documentation we're reviewing. Central incisors are usually the first to arrive, between 6 and 12 months, followed quickly by lateral incisors up to 16 months. The canines and first molars fill in the gaps through month 23. But just as important is when they leave. Those incisors shed right around 6 to 8 years of age. The second molars, they hang on quite a bit longer, usually shedding between 10 and 12 years of age. Knowing these timelines gives you a powerful contextual filter when you're reading a provider's notes. Let's move to Section 3 and see how this shifts as we transition to permanent or adult dentition. If 20 was the magic pediatric number, here is your adult baseline, 32. The total tooth count jumps significantly when we move to a full permanent dentition. Compared to the primary set, you'll instantly notice some major upgrades. We still have 8 incisors and 4 canines, but look at the premolars. We've now introduced 8 premolars into the adult mouth. Plus, we have an expanded set of 12 molars, which crucially includes those 4 third molars, commonly known to patients as wisdom teeth. The arrival of these permanent teeth is a process that spans well over a decade. Adult teeth begin replacing primary teeth around age 6 with the 6-year molars and mandibular central incisors. Maxillary incisors follow right after between ages 7 and 9. Moving into the 9 to 13-year range, we see the premolars, canines, and 12-year molars making their appearance. Finally, the timeline concludes in early adulthood, with the notoriously painful wisdom teeth erupting between 17 and 21. All right, Section 4. Practical coding implications. This is the most important part of this explainer. How do these biological timelines directly dictate your real-world CDT code selection? Let's get into it. Before we select a restorative or preventative code, we absolutely have to look out for the mixed dentition stage. This is a highly active developmental period, typically occurring between ages 6 and 12 when a child has both primary and permanent teeth present in the mouth at the exact same time. This transitional phase heavily influences your coding rules.
For example, if a provider places a prefabricated stainless steel crown, you need to know exactly which tooth it's going on to ensure you're selecting the correct code for a primary versus a permanent tooth.
Let's look at a super common high-frequency example, the prophylaxis or routine dental cleaning that removes plaque and calculus. Standard CDT guidelines differentiate between an adult and a child right at a specific age boundary. Code D1120, the child prophylaxis, is intended for patients aged 13 and younger. Code D1110, the adult prophylaxis, is used for patients aged 14 and older. Seems perfectly straightforward, right? You just check the patient's date of birth. But wait, here is the prophylaxis golden rule you need to remember. Listen to this carefully. If a child has lost all deciduous teeth and has only permanent teeth, the prophylaxis should be coded as D1110, regardless of age. Anatomy overrides age. If you have a 12-year-old patient who shed all their baby teeth early and has a fully permanent dentition, you do not use the child code. You use D1110. This is a massive aha moment for revenue cycle professionals that ensures accurate reimbursement and prevents completely avoidable denials. Let's move into Section 5 and quickly summarize these core foundational numbers before we look ahead. Keep this clear contrast front and center in your mind every single time you open a chart. Primary dentition means exactly 20 teeth, 0 premolars. Permanent dentition means exactly 32 teeth, featuring 8 premolars and those 4 wisdom teeth. Knowing exactly which teeth belong to which developmental stage is your ultimate key to coding accuracy. So 20 baby teeth plus 32 adult teeth means there are 52 distinct teeth a patient might have over their lifetime. How on earth do we uniquely and universally identify all 52 of these accurately across every single patient chart without causing mass confusion? That's exactly what we'll tackle in Part 6 when we master the universal numbering system from 1 to 32 and A to T. Please remember to like this explainer, subscribe, and follow the playlist to master this entire 20-part series. Thank you so much for learning with me today, and as always, decode healthcare with Harshal.